Hey everyone, Dr. Alex here, and today we're going to talk about one of my favorite subjects, which is helping people get rid of that pain underneath their shoulder blade, or rib cage pain, or rib joint pain, however we're going to refer to it. We're going to talk about that area between the spine and between the inner shoulder blade. We're going to talk a little bit about the anatomy. We're going to talk about our approach in the office and what I think you should be doing if this is a chronic issue for you. And then we're going to go over the best stretches to move the muscles and joints in that area. So first, we're going to go through a small anatomy lesson. So, between that area, if we move from the deepest part to the most superficial part, you're going to have the ribs attaching onto the spine. You're going to have those costotransverse and costovertebral joints. We're going to call those the rib spine joints because that's what they are. And this is the first thing that needs to be ruled out if it's the underlying problem. We often see, almost always see in our office, if somebody has a chronic issue with this part of their body, those rib joints are often dysfunctional, stiff, shifted, and they can be the root problem that needs to be addressed. Now, if we find some dysfunction or irritation with those costovertebral or rib spine joints, almost always the muscles on top are going to react to that. And that's where some people are going to be like, I have a trigger point or I have a muscle spasm. And you may need to have that addressed, but often if those underlying rib joints are not addressed, this problem's just not going to go away. So, we're going to have some spine muscles on top of those ribs and on top of those rib spine joints. We're going to have the serratus posterior superior muscle. We're going to have the rhomboid muscles. We're going to have the levator scapulae, and we're going to have the middle trapezius and sometimes the upper trapezius coming down. And so if I'm consulting with a patient, if they have an issue with this part of their spine, we need to assess every single tissue in that area to figure out what is the root cause for their symptoms, their dysfunction, and that problem. And that starts with assessing those rib spine joints and then moving upward through all the muscles. And so if you look at some of those muscles, you'll notice that some of the muscles go straight across the body. Some of the muscles are a little bit diagonal, and then those spine muscles deep, they are up and down. So that is going to determine how we're going to stretch and address these tissues. Now, in terms of moving the spine and those rib spine joints, we're going to start with that, and that's where we're going to do a modified Cat Camel. So this is similar to our regular Cat Camel, where our hands are going to be underneath our shoulders. Our knees are going to be underneath our hips. Both are vertical. You're forming a tabletop or a table. But the difference with this Cat Camel is when you go into the cat, where you drop the head, push up as hard as you can through your hands to round the back, tuck your tail by squeezing the glutes in, and then take that huge big breath in at the top. Now, a big difference that I'll do to modify this Cat Camel is I'll really lean towards the side or have a patient lean towards the side where they're having that irritation. And if they can really maximize that arching through the spine and then take a very, very deep breath to fill the lungs, expand the spine out, expand the rib cage out, that's going to help to maximize the movement through those spine joints, those rib spine joints, and then also stretching the paraspinal muscles on top. Another great stretch that can be really, really helpful for addressing the paraspinal muscles in this area, or sometimes getting to the joints as well, is going to be a slump stretch. So the slump stretch, this is one of the only times I will tell a patient to slouch down. And this is where they're going to imagine bending each vertebra, flexing it more and more and more forward. And when they get to that point where they flex their spine, trying to make it into like a candy cane or a question mark, when they get to that point where they feel a stretch in that area or in their spine, they're going to back it off a bit, rest their hands on the base of their skull, and just let the weight of their hands drag their skull down. So the hands are not going to go onto the back of the skull. They're going to go onto the base of the skull, where you feel the skull kind of bump out a bit, and the pinky finger is going to lock in there. It's almost going to be like you're pulling the skull away from the spine. but in this case, you're not pulling, it's just the weight of the hands. So in this case, what you can also do is if you lean a little bit or round the spine at the same time, this is also going to help specifically address one side versus the other. It might get down more towards those rib spine joints and some of the paraspinal muscles that are right on top. Again, this is going to be for those muscles running up and down the spine. You've tried the Slump Stretch, you've tried the Cat Camel, feeling good. Let's give you a couple of other ones. So another great stretch for this area, probably the simplest one, is going to be stretching the rhomboid muscles. So this is something that can be done at your desk. And the key with this one is not just pulling the arm across the chest, but reaching out and really imagine that you're trying to round the spine as much as possible. So it's not just the arm across, it's going to be trying to pull the entire rib cage and shoulder blade around the spine, and that's going to help to get some of those muscle fibers that are going between the spine and between the shoulder blade in that horizontal direction. Again, we can take advantage of a deep breath in this area, which is going to expand the spine and expand the rib cage with this modified rhomboid or modified arm across the chest stretch. And using those deep breaths in, we can help to get the deepest tissues there and the deepest part of the spine at the spine and the costovertebral joints. Now, a more advanced stretch for this is going to be our doorknob stretch and our modified doorknob stretch. So the doorknob stretch, we've been over a ton of times on this channel. It's grabbing onto the doorknob, really letting the butt sit back and fall backwards, almost like you're going to sit onto a toilet seat. And then you're going to try to make the letter C with your body, really, holding on and really sticking that shoulder out as far as you can to the side. And again, the more you can drop your buttock, the more you can take big breaths in through the chest to move those deep tissues, those deep joints along the border between the spine and the shoulder blade. That's going to help to get some of those more vertical and those more diagonal muscle fibers. Probably the last stretch that I would recommend doing for this area that's going to be really, really focused and efficient is going to be a modified doorknob stretch. So the difference here is instead of having the hand facing down, we're going to be wrapping our hand around the doorknob or say around the side of a wall. And with this stretch, we're going to be trying to get more of those crossed or horizontal fibers like the arm across chest stretch. But in this case, we're going to be really leaning our body into it. Now, this one's a little bit more technically challenging. It's going to be the same ideas. Holding on with the hand, you're going to try to let the body fall away from the hand as much as possible. And similar to the arm across chest stretch, you're going to try to round that spine as much as you can, almost like you're making the letter C if you were looking from above. So, if you have a muscle issue, or for that matter, a small or minor joint issue in this area of the body, those stretches, they should really, really help you get some relief in the short term. But if you're noticing that they are not enough to relieve your complaint and you've been doing them for a couple of weeks and it's still not moving the needle as much as you like, that is probably where you should see a corrective chiropractor like myself, where somebody's going to be able to get in, and if there is a problem with the spine there, we're going to be able to assess for that, find that, and address it. And then in my case, because I do a lot of electro or neurofunctional acupuncture, I can actually put a needle into that area. I can get a trigger point or a muscle spasm to relax in a very, very fast and efficient and safe way that simply stretching at home is just going to take months and months or maybe never going to work at all to do that. So I hope that was helpful to everybody. If you have any questions, comments, concerns, please leave them below. And again, always make sure that you are trying to address the underlying problem. And if these stretches don't help, make sure you contact somebody like myself. You guys have a great day.